Hi, this is Dr. Laura Tigler. Welcome to my channel. This channel is meant to provide medical information. It's not meant to provide specific medical advice. Please do see your primary care provider or your primary care doctor to obtain medical advice that's tailored specifically for your needs. At the end of the medical information, I will give some spiritual information. If you do not want to stay tuned for that portion of the video, I will let you know once the medical information portion is finished. And at that point, you can simply click away. But first, please do like and subscribe. So today we're going to talk about acute monoarthritis. I'm taking my inspiration for this talk from an article in the journal called American Family Physician. And the title of the article is Acute Monoarthritis Diagnosis in Adults. Acute just means all of a sudden. Mono means just one joint, a single joint. And arthritis means inflammation, sometimes wear and tear, but sometimes actual inflammation of a joint, a bone that connects to another bone. So acute monoarthritis is characterized by pain or swelling in a single joint. It can be a bit of a diagnostic challenge, but the physician or provider will check your active range of motion, so you'll move the joint yourself, but they'll also check passive range of motion, so if we can move the joint. And then depending on pain elicited or the extent of the range of motion, we can usually tell if the problem is inside the joint, which we call intra-articular, or around the joint, which we call peri-articular. Peri-articular conditions are examples of peri-articular conditions are tendonitis or bursitis. And those conditions often maintain passive range of motion. But, especially in older adults, remember I am a specialist of seniors, it is possible to have arthritis and tendonitis and bursitis in the same joint. So you can see how this can get complicated. So polyarthritis, which means arthritis in multiple joints, sometimes it presents with just one joint. So just because you have pain in just one joint, it doesn't mean you don't have, or you're not going to have, an arthritis problem in the rest of the body. So let me give an example. So a person comes into the office, they have pain or swelling in one joint. We might think of an infection in that joint, and we call that septic. So we call that septic arthritis. We'll look for signs of chills, or I should say symptoms of chills, fever at home, or signs such as elevated temperature. So it could be infection, but it could also be a common type of pain or swelling called osteoarthritis, and that's a wear and tear type. It could be gout. For example, let's say the person has pain or swelling in their big toe. Keep in mind that arthritis can present in just the big toe. And of course, we can get infection in just our big toe. Trauma, so you're walking around your house at night and you stub your toe. Lyme arthritis, so if we're in certain conditions where we can get exposed to ticks and we get Lyme disease. So of these possibilities, septic arthritis is the most urgent and requires prompt intervention. I mean, they all require prompt intervention because the person's in pain or has swelling. They have reduced mobility. They can barely concentrate because they have such severe pain. But you really don't want the infection to get out of hand, to spread. We can do a culture of the fluid in the joint. And since I've been practicing almost 25 years, I have been trained in various procedures. And I have performed various procedures, including draining fluid from a joint. And you can send that fluid to the lab, and you can see if there are any cancer cells, for example. You can do a blood count, see how many white blood cell counts are in there, which is an indicator of inflammation or infection. There are other tests you can do with the fluid. You can even look for uric acid crystals, which are diagnostic of gout arthritis. So these tests do help in early decision making. It's okay to ask your doctor to do an aspiration or drain the fluid if you want. Sometimes for various reasons we won't do it in the office. Like let's say the office doesn't have a nurse, or they don't have a nurse but they have a medical assistant who isn't trained in assisting the doctor with the procedure. So there's various practical reasons and medical reasons why we might not drain fluid from the joint with the first office visit. Gout is the most prevalent crystalline arthropathy. There can be others, but when those uric acid crystals form in the joint, it is exquisitely painful. You can use ultrasound to check a joint to see if there are crystal arthritic structures. Typically you'll do an x-ray, and you can even do dual energy computed tomography, which is CT scan. Gout is typically the most painful at night or in the early morning. It's exquisitely painful. You can also use ultrasound to identify if there's fluid in the joint for any reason. For example, patients over 40, if they just twist their knee even a bit, fluid can be produced in the joint, and that can be quite painful. And we can use x-ray, ultrasound to diagnose that, or honestly, it's quite easy to diagnose in the office. And the treatment is elevation, ACE-RAP, and ibuprofen, but only if you can take ibuprofen. There's many reasons why you should not take ibuprofen. So osteoarthritis, which is what I think most people think of when they think of arthritis, the term can be used interchangeably. But remember, arthritis is a catch-all term that can include many, many different forms of arthritis, including autoimmune type, but also wear and tear type. But really the correct diagnosis is osteoarthritis, the correct way to say it. And osteoarthritis affects up to 17% of older adults. So for easy math, just think 1 out of 5, 20% of people who are older. Someone who's obese, especially for a long period of time, is more prone to arthritis, and not just in the knees, but in the entire body. But if you think about it, the knees take a lot of the force of the weight of the body. In fact, we generally tell patients that take your weight, multiply it by 4, and that's the pounds of force that your knees take. So if you have a patient who's 150 pounds, you multiply that by 4, that's 150, and 150 is 300, and 300 and 300 is 600. So that's 150 times 4. So the knees are taking 600 pounds of force. So you sure don't want to gain weight because you're going to put a lot of pounds of force on your knees. But other joints are affected, like the shoulders, when we gain weight. You might have had an injury in the past, and you know the old rule of thumb. I'm sure you've been told that if you injured your joint 10 years later, you can have osteoarthritis, and that's generally true, but sometimes it can occur faster. And then hereditary factors are involved with osteoarthritis, so if your mom or dad had it, you could have it. Or if you had a career such as a ballerina or a football player, that will greatly increase your risk of having osteoarthritis later in life. Gout is the most common crystalline arthropathy, as I mentioned earlier. And now it's characterized by monosodium urate crystals, or uric acid crystals. And globally, it does have a prevalence of up to 7%, which is obviously a bit high. Gout prevalence peaks at 60 to 80 years of age, however, so it is a bit of a condition of older people. Men are affected almost twice as much as women, but women can be affected, so please don't ignore the possibility of gout. Risk factors for gout include high blood pressure or hypertension, and I have done a 3-video series on hypertension, which I encourage you to go to my channel and listen to those videos. Another risk factor for gout is high body mass index, which is synonymous with obesity. But remember, men do have a higher body mass index in general, so that could be part of the reason why they're more likely to be affected. Dehydration, that makes sense because if you don't have a lot of fluid in your system, you're not washing out those crystals or dissolving the uric acid crystals. Diuretics, I talked about that in an earlier video, there are certain diuretics that we give as a prescription for high blood pressure, for example, and they can increase our risk of gout. Alcohol, definitely a major risk factor for gout. And typically, I diagnose more gout in the first week of January. Typically, my men patients, they told me that they drank a lot of alcohol and had a lot of red meat for the holidays, and then they had the gout attack. And then this journal article mentions naturally sweetened beverages. So basically, sugar can contribute to a gout attack. There is a condition called pseudo-gout. You're probably not going to hear about that too much, but it's another type of crystalline arthropathy. It's characterized by calcium pyrophosphate crystals. The prevalence of pseudo-gout is not well understood. It could be as high as 7% based on radiographic chondrocalcinosis data, but uncertain. But it's just another type of crystals that form in the joint. Gout, pseudo-gout. Okay, septic arthritis we talked about earlier. It necessitates urgent intervention, obviously. It has an incidence of approximately 21 per 100,000 person years. Risk factors include recent joint surgery. So with almost any surgery, when you sign that informed consent, it's going to mention that infection is a risk. So you should take that seriously. Another risk factor for septic arthritis or infection in the joint is rheumatoid arthritis. I don't really have an explanation on that. I'll have to look that up and talk about that when I talk about rheumatoid arthritis. Diabetes, we definitely know that when we have diabetes, we are more prone for infection. So our immune system is hindered by the sugar molecules attaching or adhering to our proteins in the immune system. And the immune system doesn't work that well, so we just can't fight off infection very well. Gonorrhea, that's a sexually transmitted illness. We used to call it sexually transmitted disease, but whether you say STD or STI, gonorrhea can contribute to infection in the joint. So there are many reasons why you should not get an STD, a sexually transmitted disease, or a sexually transmitted illness. And now you know arthritis is one of them. Okay, HIV is another sexually transmitted illness, and that can contribute to arthritis. Intravenous drug use, that can be for multiple reasons, but an easy way to think about it is infection. If someone's age older than 80 years old, or older, they are more prone for infection in their joints. So the older we are as humans and the younger we are, generally we're not as able to fight off infections. Smoking, cigarette smoking, I'm not talking about marijuana or vaping right here. I'm giving the data regarding cigarette smoking, and I'm not talking about cigars necessarily. So when I say smoking, I mean cigarette smoking. And that's probably pretty obvious to you. So before we light a cigarette, there's about 100 to 300 poisons or toxins in that cigarette. And then the combustion process turns that into, chemically, it turns it into about 3,000 poisons and toxins. And obviously that's going to hurt our immune system and make us more prone for infection. If we have a joint prosthesis, unfortunately we can be prone to infection. And I have had patients who battle infections with their prosthetic leg or with their amputation, I should say, with their stump, not the prosthetic itself. And it can even go as deep as the bone, which we call osteomyelitis. So for the arthritis, you want to identify the causative agent, and then you can treat the arthritis properly. For septic arthritis, it's usually caused by a bacteria that normally lives on our skin called staph. The technical term is staphylococcus. Sorry, I'm mispronouncing that. Okay, and that infection, it most often occurs in the knee, but it can occur in the ankle or the foot, or even the shoulder. In the United States, Lyme arthritis is diagnosed at a median age of 25 years. Median just means that's the age in the middle. So half of the patients with the Lyme arthritis are older and half the patients are younger. So I'm not sure how helpful that is, but in a way it's helpful because it can tell you it can occur for all ages. Maybe a bit tending towards young ages. And there are 11 cases per 100,000 person years in the United States each year. It's caused by a bacteria called Borrelia, and it's transmitted by ticks, and risk factors include outdoor exposure, which could be why it tends towards slightly younger age group. So as physicians and providers, we do a thorough history, obviously a physical exam, and we'll do appropriate lab work. Limited range of motion is what I mentioned above or earlier. Effusion, which is fluid in a joint. Morning stiffness and activity-induced pain are all clues that you have osteoarthritis. The hands, knees, and hips are commonly affected, but any joint can be involved. Gout has varying involvement rates among joints, but it typically affects the first metatarsophalangeal joint, which is the big toe, and it's characterized by pain, swelling, and warmth. If it's left untreated for a long time, the joint location can go up higher in the body to the point where it can eventually go up to the knee and even up to the hands. But that's pretty rare. Most people seek care and get appropriate prevention medication. Physical exam, I mentioned that earlier. That's very important that you see your provider. Better to do it in person, I would say. Telemedicine is probably not going to be sufficient. I mentioned ultrasound, x-ray, CT scan, aspiration or draining fluid from the joint and sending that to the lab to see if there's inflammation or even cancer cells. A white blood cell count of the fluid in the joint can help distinguish inflammatory arthropathies. For example, rheumatoid, septic, or crystalline. Rheumatoid arthritis, septic means infection, crystalline is gout or pseudo-gout. From non-inflammatory arthropathies like osteoarthritis or trauma. So in summary, I recommend that if you do have pain, swelling, or warmth in a joint, especially the big toe, but any joint, please do see your doctor right away. Don't ignore it. It's easier and better if you seek help right away so we can do the proper evaluation, get proper documentation. You don't want some of these diseases to progress, and obviously if it's infected, you definitely don't want it to progress. So this is the end of the medical information about monoarthritis, acute monoarthritis, or arthritis in a joint, just one joint, single joint, that occurs all of a sudden. If you don't want to stay for the spiritual information, this is the time to click away, but first please do like and subscribe. So for the spiritual information portion, I like to let the viewers know that I am a devout Christian. I'm not trying to proselytize or turn you into anything, but over the course of many years, almost 25 years of medical practice, I have noticed that patients who have a spiritual discipline, who practice a religion, or even have close family ties, something meaningful in their life that's greater than just their own personal story, they tend to do better. They tend to have better medical outcomes, and the scientific literature does support that to some degree. I'm an author. The first book that I wrote was basically theological in nature. It's called You're Saved. You can go to Amazon, type in You're Saved, and my name, Lara, Lara, Tigler, Tigler, and you can see that book. It's nonfiction. It's primarily theological in nature, but not to be tooting my own horn, but I believe it's excellently written and highly engaging. I think that you'll really enjoy it. The second book that I wrote is called An Impossible Situation. The hero of the story is a woman of faith, but it's entirely fiction. It's just a complete work of art, imaginative, creative art from my own brain. In fact, how I thought of the story was initially a dream that I had at nighttime. So it's truly just a creative work of art. And I humbly say that that's quite engaging and entertaining. It's much shorter than the first book, and it's really just a good vacation read or to read just before bed. For an adult. It's definitely for an adult. And I'm working on a third book, and this one will also be for entertainment, but rather than being a mystery thriller like the book I just mentioned, it's going to be a bit of a psychological thriller. So this is the end of the video. I'd like to end the video with a prayer. Let us pray. Dear God, thank you so much for this beautiful nature. As you can see, I'm sitting outside next to a pool at a camping site with an idyllic sky, almost as if I used a computer graphic to put that in. That's how beautiful it is.